There's a word that still stops people in their tracks: Ebola. Not because it spreads easily across the world like influenza or COVID-19, but because when it appears, it is devastating. And many of us will remember the relatively recent Ebola outbreak in Sierra Leone. The symptoms are frightening, the mortality rate can be extremely high, and the images that often accompany any media coverage tend to trigger memories of overwhelmed clinics, protective suits, isolation wards, and international emergency responses. But currently in 2026, with renewed concern surrounding Ebola cases linked to the Democratic Republic of Congo in Uganda, it's really important once again to try and separate the fear from reality. So this episode of In Plain Sight, I'm going to look at what's actually happening, what the risks genuinely are, why health authorities are taking the outbreak seriously, but also why Ebola is fundamentally different from viruses capable of causing global pandemics on the scale of COVID-19. Now, the current outbreak involves cases in the DRC, with imported cases now confirmed in Uganda. The WHO has declared the outbreak a public health emergency of international concern due to the potential for regional spread and the need for international coordination. Now, reports indicate there's hundreds of suspected cases in the eastern DRC. There's confirmed deaths linked to the outbreak, and there's cases identified in Uganda connected to border crossing. And there is also ongoing concern about spread in high mobility areas, including the mining regions, which are many, and transport routes. Now, the World Health Organization, the African CDC, and the national health agencies are monitoring the situation really closely, as you would imagine, with containment efforts including contact tracing, isolation precautions, border screening. There's some community education that's taking place and enhanced surveillance systems. The WHO has specifically stated that the current outbreak does not meet the criteria for a pandemic emergency, and that distinction matters enormously. An infection that has a very high mortality rate cannot cause a pandemic. What has raised concerns, however, among health authorities is the cross-border spread into Uganda, cases appearing in urban areas of Goma and Kampala, ongoing conflict and displacement in regional areas, and the fact that this outbreak involves a rarer strain of Ebola for which there are no currently approved vaccines or targeted treatments. And yet, despite all of that seriousness, Ebola still spreads through close contact with bodily fluids. It is not airborne like influenza and COVID, so there is no other way to acquire it. And that's why public health officials are talking about containment, not inevitability, because the concern is regionally escalated and it has a humanitarian impact, but it isn't an extinction-level global pandemic scenario. And that's where the nuance matters, because responsible public health communication means acknowledging genuine risk without driving fear-driven speculation. And that is where it's important to distinguish the people on social media who are bending and twisting the truth to monetize for clicks and likes, and where the actual truth lies. Because most of what they say has tiny elements of truth embedded in a lack of context, misinformation, and sometimes outright lies. But it makes it very easy to acknowledge and to agree with and believe, because it has just the right amount of truth to make you believe it. But most of them, and currently Instagram is awash with conspiracy theories about vaccines, Ebola, hantavirus, COVID. 99% of them are talking absolute crap. Please do not fall for it. So what actually is Ebola? Well, Ebola is a viral disease that causes severe viral hemorrhagic fever, and it is spread through direct contact with bodily fluids, blood, vomit, feces, contaminated materials, a la the above, and in some cases infected animals. Bats predominantly are believed to be one of the main causes. It is not spread casually through the air in the way that measles or the aforementioned COVID-19 can spread. Now, symptoms include fever, weakness, vomiting, diarrhea, muscle pain, bleeding in severe cases, and organ failure. And depending on the strain and access to healthcare, mortality rates can vary significantly, but some outbreaks have seen fatality rates above 50%, if not higher. And it's that mortality rate that's important when discussing public fear. Now, Ebola, I said, is unlikely to cause a global pandemic, and this is where the nuance matters. Ebola is extremely serious, no doubt about it. Serious does not automatically mean likely to become a worldwide pandemic. In fact, one of the reasons Ebola outbreaks tend to remain geographically limited compared to other respiratory viruses, SARS, for example, is because, as I mentioned, Ebola is too severe too quickly. People infected with Ebola often become critically unwell really quickly, which prolongs the period of asymptomatic spread, makes cases easier to identify clinically, leads to faster isolation, and limits the ability of infected individuals being able to travel widely. It's very different from SARS-CoV-2, MERS, where people spread infection before they even knew they were ill. And Ebola also requires close physical contact for transmission. It does not spread through casual day-to-day airborne exposure in public places. Now, historically, Ebola outbreaks are devastating locally and regionally. We only have to think back to Sierra Leone, particularly where healthcare infrastructure is stretched. And this one hasn't demonstrated the transmission characteristics associated with sustained global respiratory pandemics, which we are very, very attuned to in a minute. That doesn't also mean that complacency is appropriate. All it means is that proportionality is important, is appropriate, and does matter. Now, even if Ebola is unlikely to become the next COVID, as everyone's saying, it remains one of the most dangerous infectious diseases known to medicine and mankind. Healthcare workers are at particular risk during outbreaks due to the potential exposure to said bodily fluids, limited PPE resources in some areas, and certainly some parts of the world, delayed recognition of cases because it can present as malaria, and high viral loads in the severely ill patients. You have to bear in mind that by the time someone gets to the end stages of the disease, and we are talking days, even their sweat is infectious. So all of these things have to be taken into account. As someone that worked at a hospital during the Sierra Leone Ebola crisis, we were taking soldiers who were working in Sierra Leone that would be being, sent home to the local garrison. And then because they were suspected Ebola cases, they were being admitted to our hospital, and we had the PPE and the donning and doffing areas and the cleaning protocols. And there was a mass amount of drills that were taking place to ensure that everything was followed exactly to the letter, because the risk to human life is massive if you get it wrong. And past outbreaks have tragically involved larger numbers of healthcare workers acquiring the infection. But there are also wider risks, and particularly if you associate with the country that we're currently talking about, there's cross-border spread into neighbouring countries, pressure on already fragile healthcare systems, there's community distrust, there's plenty of misinformation. Disruption caused by fear and stigma, and delays seeking medical care again, because initially it can be confused for malaria. But importantly, outbreaks occurring in conflict zones and areas of poor infrastructure become much harder to contain, just because of the nature of the circumstances that it's occurring in. But there's also a part where infection prevention and control becomes absolutely central. Outbreak control depends really heavily on early identification, isolation, hand hygiene, PPE, the gold standards, safe waste management, environmental cleaning, safe burial practices, staff training, and contact tracing. And none of this is theoretical. A lot of them are the same core principles infection control teams use every day across the world. It's just applied in a much higher risk context. Now, the World Health Organization, OXA, and the CDC continue to stress that rapid infection prevention control implementation is one of the most effective ways to stop Ebola outbreaks from escalating. You break that chain of infection, and that is it done. But there is a conspiracy problem. Whenever outbreaks occur, misinformation follows quickly, and it is. And there's claims emerging that suggest it's a hidden global plot by the cabal. It's always the cabal, isn't it? Manufactured outbreaks, it's a bioweapon, secret cover-ups, deliberate spread, and all that nonsense that goes with it. And as always, there's no credible evidence to support any of these claims whatsoever. People will say there is, but they never present it. What is supported by the evidence is the cross-border transmissions, again, known historical patterns of Ebola emergence in endemic regions, difficulties caused by healthcare equality and regional instability, and the importance of rapid public health intervention. The reality is already serious enough without idiots adding unsupportive narratives. Ebola deserves respect, not sensationalism. All of these people who claim that they have wonderful immune systems and they've never needed to be vaccinated and anyone who takes a vaccination is an idiot, I task you, please go and visit this country without a mask and PPE and see how well you get on with your overpowered immune system that you're always, lording over everyone else that you've never been vaccinated and you're as fit as an ox and you've never been ill. Please do. And come back to me and tell me the outcome of your story. The likelihood is you won't be able to because you'll be dead. However, it deserves respect, not sensationalism. The current outbreak in the DRC and Uganda is significant and requires strong international coordination, which is getting, especially to protect healthcare workers and prevent wider regional spread. But it's equally important not to confuse a highly lethal virus with one that is automatically capable of causing a global pandemic. They are not the same thing, no matter what anyone else tells you. Good public health communication means holding two truths at once. Ebola is dangerous. Panic is not evidence-based. And possibly the most important lesson in all of this is fear, as I've always said, spreads faster than facts unless someone is willing to slow things down and explain the difference. Ebola's back in the headlines with confirmed cases in Uganda linked to the outbreak in the Democratic Republic of Congo. It's serious, but it is not the next pandemic.